All right, welcome back and thank you so much for staying with us here on Morning Live. Now, yesterday, the Sefularo Family, in partnership with the Sefako Makgatho Health Sciences University, hosted the Inaugural Dr. Molefi Sefularo Memorial Lecture at what would have been his 60th birthday. Dr. Sefularo was born on the 9th of July 1957 in Ikageng township in Potchefstroom, Bokonebophirima. He was the Deputy Minister of Health at the time of his death in April 2010. Prior to that, Sefularo was a Member of Parliament from 2004 to 2010 after serving as the MEC for Health in Northwest from 1994 to 2004. The Memorial Lecture serves to celebrate the life of a dedicated public servant, an activist, a comrade and a father. As a youth activist, Dr. Sefularo was jailed several times. He was the founding member of the Azanian Student Organization in 1979 and was also elected secretary in 1981 when he also served as the Student Representative Council President at his alma mater. The Sefako Makgatho Health Sciences University, previously known as the Medical University of South Africa, Medunsa, that is where the lecture was held. So it is also the institution at which he obtained his Bachelor of Medicine and Surgery. Sefularo was a member of the United Democratic Front from 1983 until it was banned. All right, and now African National Congress Treasurer General Dr. Mkhize gave the keynote address at the Memorial Lecture, and he joins us in our studios here in Johannesburg to take a look at the lecture. Dr. Mkhize, good morning to you and thank you so much for coming through.
Good morning to you and all the viewers.
Now, let's just, get a reminder from you as to why the late Deputy Minister of Health was so important and his contribution in South Africa.
Well, he was a very important leader, firstly amongst the leaders in the African National Congress, but also in society in general. He was very dedicated to his work, and he worked in several areas, largely on the area of health. Now, we come a long way back with him at the time when he was a student activist. They were the first SRC to be inaugurated in Medunsa, what was called Medunsa then. And part of what they had to do was to activate the students to be always alive of their roles and responsibilities as students, and also prepare them for working out in a very poor community out there. But in addition, we worked very well with them, trying to ensure that the university, which was originally created to train low-grade doctors, was actually ultimately able to provide the necessary quality of education, which is what ultimately they were able to achieve. Now, over the years, he worked as a part of the struggle, as part of Mkhize, was part of the NAMDA, which was a National Medical and Dental Association, which was mobilizing doctors around the issues of health, primary health. He worked also for progressive primary health care as a researcher. So he was a very well-known figure in the leadership of the health activism. When he joined government, I served with him as well as the member of the Executive Council, and at that time we were responsible for trying to pull together the fragmented health services, and he did that to pull together the Bophuthatswana and the Transvaal progressive provincial administration structures to create one administration, and we worked together with Dr. Nkosazana Zuma as a minister to pull together the first post-apartheid Department of Health, and we were amongst those activists. They were fighting very hard to bring in the treatment for HIV and AIDS, the prevention of mother-to-child transmission, and also help at the time when there was no cure, there was no hope. And so he remained a very outstanding leader. So when he became the deputy minister, he was also very active in the promotion of education for medical students, particularly going out to liaise with Cuba to make sure that the welfare of those students and their progress is ensured. And then he also worked very hard inside the department, in supporting the programs of the ministry.
So this is someone who has worked very hard for ensuring that we have the healthcare system that we have now.
He worked very hard, but also he was a very strong proponent of the national health insurance system, whereby our goal is about ensuring universal access to quality health care for all, which is a goal that we haven't achieved, but quite a lot of work was done during his time as well, and he went all out to champion the cause for this universal health care. And I believe that the work that we have to continue doing will be continuing on the work that he had laid a foundation on.
But do you think he would have been proud with what South Africa has achieved in terms of the healthcare system?
I think there would be areas where he would be proud. If you look at the time when he started as a deputy minister, that's when the whole program was introduced to do the testing, championed by Minister Mtsoaledi, and they worked very well together on that issue where, millions of South Africans were actually tested for HIV and AIDS, and in addition, you ended up with a lot of treatment that went out. And if you look at the improvement in the life expectancy rate, it was very dramatic. It's something that I think we had not thought that it was epidemiologically possible to shift the life expectancy from around 49 to about 60 years within a space of a few years. Yeah. So that's another area where I think he would have been proud. There are lots of other areas where I think he probably might not have been proud of. The level of litigations that we see in the health services is very high. To the extent that that might be reflecting inefficiencies in the system, I think we all need to work hard to make sure that's resolved. Some of the problems that we have seen, Gauteng, Life Esidimeni, some of the forensic, services problems, and then you also have some of the concerns that came from KZN and so on. So a lot of areas would need to be attended to.
Now, the venue of the lecture, the venue was previously called Medunsa. Now, I want you to share with us what went through your mind as you were, delivering this lecture.
Well, I happen to have been amongst those students that had the option, that were there at the time where the Medunsa was opened. I didn't go to Medunsa, but some of my classmates went to Medunsa. I was aware that at that time, the University of KwaZulu-Natal, which was called the Black Section, had gone on protest because the apartheid government wanted to close down University of Natal for training black medical students and only open those in Medunsa really for training the students to serve the homelands and the black communities. And there was an associated, impression that this would be a lower level university, and everybody fought against that. And so the fact that a lot of academics from University of KwaZulu-Natal at this point came over to support and reinforce the quality of training has actually been quite an achievement. And of course, the students fought very hard to make sure that the curriculum was able to provide them the kind of quality that is equivalent to all the doctors all over the country.
So it actually brought back some memories in terms of how far we've come.
And also I think the man that they are honoring with Sefako Makgatho name is a very important man in the leadership of our struggle. He was the president that took over after John Dube, and in that process, he also introduced a lot of changes inside the African National Congress. He brought in the Constitution. He started writing the issue around a document about the Bills of Rights early on at that particular time. And so he also is a giant that is worth honoring. So I think that the combination of that institution, I made the point to the alumni and the students and the academics that with the name that they are honoring, with the institution and the history of the institution, we expect very high quality of care and very high level of ethics and values from those who come out of that institution.
All right. Now, we know that, Dr. Mkhize, this morning you'll be addressing a group of aspiring women entrepreneurs. Why is the development of female leaders so important for us in South Africa?
Well, it's very important, firstly, because it's part of completing the issue of our a struggle which was about race, class, as well as gender. And I think the issue of emancipation of women becomes a very, very important issue. But I think also important is also always considering the numbers of women in terms of our demographics is so high that it would be neglecting society if we do not help to develop as many of the women into leadership positions.
But we're seeing their male counterparts much more developed than the females.
No, I think there's a historical issue. At this point, there's a lot that has been done to open up space for women to be trained, particularly the focus on girl children and boy children, that they must be able to understand the issue of equality, and that young girls have to be confident of themselves, and they must know that it's their talent and their skills that will matter. It's not their gender that will determine what role they'll play in society. And so I'll be talking to them to motivate them, to indicate to them that the whole world now is ready for them to come in and play the role that they can play, and that from the schools that they come from, some of them come from very disadvantaged schools, that we do not expect that the disadvantaged, poor community background that they come from should determine where they ultimately end, even though when they start, they will have started under very difficult circumstances. So we need to actually motivate them to be confident. I'm a father of 2 daughters, and my role has been to say to them that, you know, the sky is the limit. It's up to them what they want to ultimately achieve.
All right. Now, just a quick one in conclusion, Dr. Mkhize. The ANC is fresh from the policy conference, of course, that ended last week. And this morning, one of your alliance partners, the SACP, is beginning their 14th Congress. How is the ANC interacting with this event?
The ANC will be sending a delegation to be part of the conference as invited. It's been tradition. We hope to interact with them, firstly to share with them what the outcomes were from our consultative conference, but also to indicate that conference in general and the ANC as a whole believes that this is the time to strengthen the alliance relationship. It's also a time to make sure that whatever challenges we have, we resolve them. It's not the time for the alliance to be dismantled. And so we need to find ways to deepen our relationship and discuss over the issues where we've got different views.
But how is the relationship currently between the SACP and the ANC, more so after they are called for President Jacob Zuma to step down?
Well, I think that it's not ideal, but I think we need to also take that in the context that the Communist Party, COSATU, are independent organizations who are capable of taking their own decisions. We would have preferred that when they take decisions, we meet with them and discuss them, not having to debate them in the public arena. And for that reason, therefore, we believe that whatever differences there are, we need to find ways to sit down and discuss. But going into the future, it would be disastrous for this alliance to be dismantled at this point. I think neither of us will emerge as winners. So we'll be sending that message across to the Communist Party. Of course, we wish them well in their conference, and we believe that whatever they will be discussing there should be able to help all of us, both as the ANC and the alliance, to help the country to move on.
Because now there is a talk that they want to go on their own during the elections.
Well, that's been a discussion. I'm not aware that there's a conclusion already reached. They've raised the issue to say that this is the discussion. But we are basically engaging precisely for that reason, that we don't think this is going to help the ANC, it's not going to help the alliance, it's not going to help the partners, not the country as well.
All right, Dr. Mkhize, due to time constraints, we'll leave it at that, but thank you so much for talking to us.
Thank you very much.
Thank you very much. Well, Dr. Mkhize is the Treasurer General of the African National Congress, and he was the main speaker yesterday at the inaugural Dr. Molefi Sefularo Memorial Lecture that was held at the new auditorium of the Sefako Makgatho Health Science University in Garangua. Let's take a break here on Morning Live.